Well, health workers' unions in South Africa have warned that hospitals in the country will be overwhelmed if COVID-19 cases continue to rise. The country has seen a record spike in COVID-19 cases with more than 42,000 infections registered in just 3 days. That brings the total number closer to the 1 million cumulative cases mark. Sijutienzi Lisanjamela tells us more.
South Africa is dealing with a new strain or variant of the COVID-19 virus. And according to health officials, it is spreading rapidly and is driving a second wave of infections. On Christmas Day alone, the country recorded 14,796 new cases. Health unions are now anxious. They have expressed concern that if cases continue to rise at this rate, the situation will only get worse.
It is a genuine concern that we've got with the current rise in statistics, especially with this second surge as it has already been declared. And one of our biggest concerns is the shortage of nurses, particularly, because we've already received reports and complaints of nursing 3 nurses being responsible for 9 ICU patients. And that's just the tip of an iceberg.
DINOSA is the Democratic Nursing Organization of South Africa. Many other health unions share this worry.
Our worry is that what we experienced during the first wave, we are still going to experience it. At some point, our hospitals, our wards were full to the rafters. We were putting patients on tents. What is going to happen now during the second wave, of which it is more dangerous and brutal compared to the first wave?
South Africa's healthcare system has for a while now been in urgent need of major reforms. Even the government has on a number of occasions admitted to this. The public health system in this country has been described as broken. Facilities are overburdened and understaffed. And the COVID-19 pandemic has added more strain.
And with the added weight and the surge, the numbers that are rising right now, the healthcare system is most likely going to collapse. And to make matters even worse, we are now in a festive season where we've got all the trauma cases that are increasing due to alcohol and all these other things.
Before COVID-19, we've been complaining about gross shortage of staff and gross shortage of material resources. There's no different. There's no new hospital that has been built. There's no new material that has been bought, even during this COVID.
In a statement, the Health Ministry has warned that the government will now need to review the current restrictions and consider further measures. Yudi Sanjamela for CGTN in Johannesburg, South Africa.